This is Health Check on GH Today. My name is Nanama Anobempong, and today we are going to be speaking about postpartum or postnatal depression, and we'll be speaking with a consultant obstetrician gynecologist by the name of Dr. Promise Sefoga. We'll be right back. Hello, you're welcome back. We're here with Dr. Promise Sefoga, a consultant obstetrician gynecologist. Dr. Sefoga, you are welcome.
Thank you.
Thank you too. So today we are speaking about postpartum depression. So what is postpartum depression?
Right. So postpartum depression is one of the common medical disorders that would happen after delivery. So typically it's a form of depression, and it happens either late in pregnancy or just after delivery. You know, there are various classes. It's a group of medical disorders that are called postpartum depression or perinatal depression, which is the new term we use for it. It begins with what we call maternity blues or baby blues, where the woman just feels a little low in mood soon after delivery. They'll be then just be tearing or a little down, but that shouldn't last for too long. Hardly does it go beyond 2 weeks. That's the baby blues. So the postnatal depression will last longer, and the signs of symptoms of depression, like the woman is down, doesn't feel like eating, doesn't feel like talking, doesn't, you know, when you have a baby, you have to be excited because baby has arrived, you look forward to it. The woman really doesn't, and they don't really feel up to taking care of the baby, and sometimes they just take care of the baby as a matter of course, not out of any excitement or nothing extra. And then they could have sleep disturbances, and also in the extreme case they would actually feel that their life is not worth it. They can actually feel suicidal at a point.
You mentioned about sleep, changing sleep. Obviously, when you have a child,
exactly,
the first thing that happens is sleep loss.
Of course.
So what,
every 2 to 3
what
hours
makes it
you have
different?
to wake up to breastfeed. But this time, what happens is, so during the day, the typical breastfeeding mom will catch some nap during the day, but that doesn't happen with a woman who has depression. And sometimes it gets so bad, like I said, recently there was a reported case where the woman had a baby about 4 weeks later, strapped the baby at the back and attempted to jump from the first floor. Yeah, she was depressed. She wanted to kill herself. So those are the common ways they would manifest. A lot of the time society thinks that, oh, it's a normal thing, but it's not. The baby blues, yes, but that shouldn't last more than 2 weeks. If it's getting that bad, we need to quickly report it. Then there's a way of managing it. Yeah.
So what would you say are the triggers of postpartum depression?
Right. I mean, traditionally, one of the things we know is a first-time mother. But interesting, some research we did recently in 3 hospitals in Ghana, which I led in particular, proved that women who had 4 or more babies, 4 or more children, they've had first 2, 3. If this is the 4th one or 5th, then they are more likely to get depressed.
When you're having to care 5 children at once, especially if they're younger, I suppose.
Exactly, you know. And then if the woman already had some mental health issues, there's something called bipolar disorder, where they can have a high mood and low mood. People are like that, what we commonly call mood swings. People who have that tend to have postnatal depression as well. And of course, someone who already had depression or any mental disorder already, anxiety disorder, they also at a higher risk of developing postnatal disorder. A woman who, postnatal depression, a woman who is in a very violent marriage, you know, partner is violent, aggressive, abusive verbally or physically, they tend to suffer it a lot more. And we found that women who had delivery through surgery were a little more at a higher risk. Some people who had pregnancy complications, or those who had babies who were delivered preterm and the babies had to be in the neonatal intensive care unit, they were found to be a bit more at a higher risk of developing it. And women who had blood transfusion around the time of delivery, they tend to have a bit of higher risk. Yeah.
So you also mentioned about it being just before somebody's coming to give birth and then just a little after. Can you go into that a little bit for me?
Yeah, so sometimes the problem begins towards the end of the pregnancy, in the last trimester. So which we call it perinatal, around, and then it persists after delivery. That is also a part of it. For some people, it just happens after the delivery of the baby. Yeah,
Okay.
but both of them are the same. Typically, what happens is, when the woman is pregnant, there is high level of certain key hormones we call progesterone and estrogen, and soon after delivery, the levels drop sharply, and that triggers the center of the brain that will cause you to feel low rather than feeling normal. It can happen to anybody. It's so common, about 1 in 10 women suffer that. But like I said, a lot of our people do not report it because they don't even know it's a problem. Relatives don't even know.
So you mentioned a lot don't report it. Like I've heard of people who are also a bit maybe embarrassed or ashamed about it. Like, oh, I feel like, I feel really tired all the time, and you just think that, oh, well, I've just given birth, so it's okay. So what could you say that somebody should maybe look out for?
Yeah.
Maybe somebody who is looking onto a pregnant woman.
Yeah. So like you're saying, they feel so low in mood. They don't feel like doing anything. And then appetite is poor. You should see that bonding with the baby is not happening. She just cares for the baby, breastfeed, put the baby down. Then you know that, no, something might be wrong.
Okay.
It's not a problem if you report. We assess and we say, oh, you're perfectly normal. We are better off than you come, or you don't come when it's a real problem and then pushes you into severe depression with suicidal tendency. Yeah.
So
Yeah, so anybody caring for any postnatal woman, look out for these things. How is her mood? And then the least you suspect, come and let's assess. Let's be the one to say it is normal, it's not normal.
is it hereditary?
To some extent there is, because people who are prone to mental health disorders are at a higher risk. So to a little extent it could be hereditary. And then if a woman had it, her daughter is likely to have it than a woman who did not have it to some extent. But it's not caused by only one thing. There are so many factors, like I said. Yeah.
So after 2 weeks, the woman is still feeling down and people are noticing some behavioral changes. What would be the treatment options available?
Good. So treatment would depend on, we call it management. Management would depend on the severity. In a large majority of cases, we just let a clinical psychologist take you through psychological therapy. That's about all. There's something we call cognitive behavioral therapy. That works in the majority of cases. In very few cases, they may have to go on antidepressant medication to help them for a couple of months, and then they go off. Yeah.
So what about things like maybe some relaxation therapies, or
Yes.
do they also
Yeah,
work?
they also help. They also help. So the main thing is, let's get it reported. Then the experts would figure out what will work best for who, based on the severity or otherwise of the disorder.
Okay. Can something like breastfeeding help?
Of course, breastfeeding helps to improve bonding. But if the problem is there, they still breastfeed, but it doesn't achieve what it's supposed to. So, but if the woman has, for some reason or the other, not been able to breastfeed, she's likely to feel down than the woman who is freely lactating and breastfeeding. Yeah.
So how long would you say it like on average? Maybe it lasts, like the postpartum depression
No,
lasts.
so it varies. It varies depending on the severity and the woman's own factors. But it shouldn't last. It can go as far as a year or beyond. Yeah, it can, especially if it's not reported and dealt with early.
Okay.
Yeah.
Then, as maybe the partner of the woman or those that are helping with the child, what can they also be doing to help?
Yeah, that's very important. They need to be supportive, because what a woman needs is a lot of support. Not like, oh, this woman has become so pompous after delivery. When you talk to her, she's not minding you. No, that will just make things worse. The partners, relatives, family need to understand that there's something going wrong. So let's help her out. Let's get her to get help. And when they come back from the hospital, let's be supportive. Let's try and engage her, support her, encourage her that, oh, it's normal, you get out of it. Yeah, and that works.
Okay. Because in Ghana, that type of thing it's sometimes lacking.
Yes, even though we know that we have a stronger social support than, say, in Europe, but we are just there. We think whatever the woman is going through is normal, or she's being proud, instead of trying to understand that, no, it could be a medical problem that we need help. so that we can just leverage on the availability of our social support and then bring them forth for expert evaluation and then appropriate treatment timeously.
Thank you so much for watching Health Check today. My name is Nanama Anobempong, and we have been speaking with our consultant obstetrician gynecologist, Dr. Promise Sefoga. See you again next time.